According to national data, more than 22,000 people are treated for substance use disorder in Maine each year. Inpatient rehab alone can cost up to $1,000 a day for patients without insurance. However, several nonprofits are working to make treatment more accessible.
Those organizations are trying to give Mainers with limited means a chance to break the cycle. News Center Maine's Vivian Lee explains.
A couple years ago, John Reynolds, who had been in active recovery, relapsed back into substance use disorder. When John was ready to get clean, there were no options because he didn't have health insurance.
We ended up calling every detox here in the state of Maine. Nobody would take me. They had no beds.
He turned to his friend Ryan Page, who runs a nonprofit, Access Direct Recovery Network. Ryan, also in recovery, helped find a bed for John at a detox program in New Hampshire, covered by a grant.
I think grant beds are incredible because you don't even know how important that is for people that don't have any way to pay or any insurance.
John, who just marked 3 years of sobriety, is now the organizing director of the Maine Recovery Advocacy Project. The grassroots network works for community and policy solutions to substance use in Maine. Advocates are now pushing for a bill, LD 514, that would increase Maine care reimbursement rates for programs, including Milestone Recovery and other facilities throughout the state that provide medically managed detox beds.
I got lucky and found a bed. Not everybody gets lucky. Most people die trying to find them. This bill, if it gets put through, is going to create more open beds, more access for people.
If approved, the legislation would raise the current Maine care reimbursement rate from $426 to a little more than $594 a day. Supporters say the increase would allow detox programs to expand and save taxpayer money at the same time.
When people are not able to access treatment, they're getting arrested. They're now going to jail. They're detoxing in jail. That is also costly.
Ryan and his wife Cynthia run Access Direct Recovery Network out of their home in Vassalboro.
We'll follow up and you'll have my number.
Besides answering nearly 1,000 calls a month, the couple and volunteers connect people to a network of resources, from residential treatment beds to self-help meetings. The nonprofit, which plans to move to a new location in Biddeford in April, also helps sponsor the annual Black Balloon Day. The event this Saturday at the Rock Church in Bangor is a tribute to Mainers who lost their battle with addiction and to support those trying to break the cycle. While there has been more than a 30% decline in fatal drug overdoses in Maine over the past 2 years, overdose deaths are still averaging more than one a day. In 2024, the total deaths were 490.
We have work to do. So it's bittersweet to remember those people.
Advocates say that even one life lost is one too many. In Augusta, Vivian Lee, News Center, Maine.
A hearing on LD 514 is Monday at 1 o'clock in Augusta. That will be before members of the legislature's Health and Human Services Committee.